The IU School of Public Health in Bloomington will study racial disparities in the distribution of naloxone, the life-saving medication that reverses an opioid overdose. Kayan Tara reports that the African-American community in Indianapolis seems to be hit the hardest.
The $1.7 million grant from the Department of Health and Human Services will fund an investigation of the role structural racism plays in stigma and death from opioid use in the Indianapolis African American community. School of Public Health professor Dong-Cho Seo will head the study. He says the United States is in an opioid crisis due to methamphetamine-related overdoses.
The overdose crisis is a serious problem, and we are increasingly seeing evidence of racial disparities where black people are more disproportionately affected by overdose death.
Black Americans are about twice as likely to die from opioid-related overdoses compared to white Americans. The Center for Disease Control and Prevention says that 14% of people who die of opioids were treated for substance misuse, but only 8% of African Americans were treated, the lowest of all groups. One community partner on this study is the Overdose Lifeline, a nonprofit that educates about preventative measures against substance misuse. The organization noted racial disparities when distributing naloxone in local Indiana communities.
We did like 35,000 doses of naloxone, and only one person identified as Black or African American, which was a problem for me.
Crabtree is the program and office assistant at Overdose Lifeline. She says recovery is possible, but people need to be reached before they overdose.
Although we distribute naloxone and we distribute it free, wherever you're at, you can put in a request, we'll put it in the mail. If you're nervous and you don't want your name on it, we'll send it to current resident or whatever. But for whatever reason, we're not stepping up to the plate and reaching our people that need to be reached.
Justin Phillips is acutely aware that it takes seconds for someone to overdose if life-saving methods are not implemented. She lost her son Aaron to an overdose in 2013. This prompted her to start Overdose Lifeline. Phillips says substance use disorder is such a judged and stigmatized chronic disease that people are afraid to ask for help.
All of those things just, I think, create a barrier for people to be willing to ask for help. And if I don't think I need it, I don't pay attention to the information.
John Agley is the Deputy Director of Research at IU's Prevention Insights. He said that building infrastructure to understand how opioid use affects individual communities is imperative to solving the issue.
While many communities may have specific kinds of harms associated with opioid overdose, the things that lead to those harms and the things that could protect against those harms are different. And so if we try to just take generic ideas and bring them into a single community, some of that may work and some may not.
Overdose from opioid use can be prevented by better education and awareness on the topic.
Them can be very easily prevented. Even, you can at least stop people from dying by administering naloxone within 3 or 4 minutes. Okay. So that is really, awakening me, and I, became more and more interested in this area.
For Indiana News Desk, I'm Kayan Tara.
Naloxone is available without a prescription in all states. Individuals can go to naloxbox.org for more information.